Welcome to The Explainer. Today, we're unpacking the biology, the mathematics, and the psychology behind how communities actually protect themselves from disease. We hear the phrase herd immunity thrown around all the time, right? But to really get it, we need to look way beyond the basic medical definitions. So we're going to break down how a simple childhood game perfectly models global health, exactly how epidemiologists calculate risk, and the psychological triggers that actually persuade people to step up and protect the vulnerable. Okay, here's our roadmap for today. 1. The immune system shield. 2. Playing Jenga with health. 3. The math of outbreaks. 4. When the tower falls. And 5. The psychology of prevention. Let's jump in. Section 1. The immune system shield, building defenses. Now, at its core, herd immunity, or community immunity, is really just a numbers game. It simply means there are too few high-risk, susceptible people around for a disease to actually find a new host. Think of a virus like a spark. If too many people are highly flammable, that fire is going to spread like wildfire. But if enough people are fireproof, well, the flames hit a dead end, and the infection just peters out. What's super fascinating here is the contrast between our body's long-lasting internal memory and the temporary but totally life-saving passive shields we can get. See, active immunity is your body doing the hard work. It recognizes a pathogen from a past infection or a vaccine, and it stores that info in memory B and T cells. It's ready to fight at a moment's notice. Passive immunity, though, that's borrowed. It's the vital antibodies a newborn gets from its mother or specific antibody treatments given in a hospital. It's incredibly important, for sure, but it is short-lived. To build real lasting herd immunity, a community absolutely needs high levels of that long-lasting active immunity. All right, Section 2, Playing Jenga with Health, a biological metaphor. To really visualize this, imagine a classic game of Jenga where the entire wooden tower represents your local community. In this scenario, you are playing as the infectious disease, and your one and only goal is to pull blocks right out of that tower. Now, the rules of this specific game are crucial. The colored blocks, those represent immune or vaccinated people. The uncolored blocks represent the unvaccinated or the vulnerable, like newborns, the elderly, or folks with compromised immune systems. And remember, as the disease, you can only pull the uncolored blocks. So if a population is highly vaccinated, the disease really struggles to find and remove those few uncolored blocks. The community tower just remains strong and stable. The disease literally hits a dead end. But let's flip the board for a second. If the vast majority of the blocks are uncolored, the disease has an absolute field day. It rapidly pulls block after block and the tower quickly collapses, which represents a massive, rapid outbreak of infection. This is such a brilliant illustration of why vulnerable people rely entirely on the structural integrity of the vaccinated blocks around them. They just can't protect themselves. Their safety depends completely on the strength of the collective tower. Moving on to Section 3, the math of outbreaks. Calculating risk. Before public health officials can even set vaccination goals, they need to know their enemy. So they use a metric called the basic reproduction number, pronounced R0. R0 tells us exactly how contagious a disease is if it's introduced into a room where absolutely nobody has any immunity. It's essentially the baseline mathematical contagiousness of a virus. When we actually compare these numbers, the sheer difference in infectivity is, well, it's pretty shocking. One person with the seasonal flu will, on average, infect about 1.3 other people. Someone with chickenpox, they'll infect around 8.5 people. But measles, wow, one person with measles will infect a staggering 17 people in a susceptible population. It is quite literally one of the most contagious viruses known to humanity. So epidemiologists use this cold, hard math to determine the exact threshold of immunity a community needs to stop a specific disease in its tracks. They use a simple formula, 1 minus, in brackets, 1 divided by R0. If we plug in that crazy high measles R0 of 17, we get 1 minus 1/17, which equals 0.941. And that translates to exactly 94%. Because the R0 of measles is so incredibly high, a staggering 94% of the population must be immune to protect the community. Compare that to the seasonal flu, which only requires about 23% immunity to stop its spread. This math is exactly why public health targets for measles vaccination are set so incredibly high. If you drop below 94%, you are leaving the door wide open. Section 4. When the tower falls, a cautionary tale. Let's look at a real-world example from the Pacific island nation of Samoa.
Back in 2018, two nurses accidentally used a muscle relaxant instead of saline to prepare vials of the measles vaccine. Tragically, this caused infant deaths. And because the government kept quiet about the specifics of the accident, massive fear and misinformation just spread like wildfire. Parents were terrified. By early 2019, vaccination rates plummeted to a shocking 30%. They pulled far too many colored blocks from their community tower.
The results? It was completely devastating. Remember, measles needs that 94% coverage to hold the line because its R0 is 17. At just 30% coverage, the population was practically defenseless. A deadly outbreak swept through the country, resulting in thousands of cases and 83 deaths, mostly young children. Ultimately, the government had to declare a state of emergency and force mandatory vaccinations just to rebuild the tower. This localized collapse serves as a really sobering cautionary tale of what happens when that mathematical threshold is compromised. Which brings us to Section 5, the psychology of prevention, social norms, and advocacy.
Knowing the math and the consequences, researchers at the University of Western Australia conducted a fascinating study on over 400 parents. They wanted to see what kind of messaging actually influences vaccine advocacy. They looked at two distinct types of social norms. First up, descriptive norms, which is simply stating what people actually do, like telling parents that 92% of others vaccinate their kids. Second, injunctive norms, stating what people morally approve of. For example, telling parents that others believe vaccination is the right, responsible thing to do. Now, the study revealed something super surprising. Sharing just the descriptive norm, that did almost nothing to change attitudes. Sharing just the injunctive norm, also low impact. But combining them into what they call a conjunctive norm, basically telling people that the majority does it and the majority morally approves of it, that significantly increased positive vaccination attitudes and behavioral intentions.
So what does this actually mean? It means the secret code to effective public health messaging isn't just dryly explaining the science or terrifying people with the math. It's proving that your peers are actively participating in the solution and that they morally approve of doing so. People really need to know that building the community tower is both normal behavior and celebrated behavior. As we wrap up this explainer and reflect on the delicate Jenga towers of our own communities, I want to leave you with this question. How can you use these psychological tools, these descriptive and injunctive norms, to better protect the vulnerable among us? Whether it's advocating for vaccines or supporting literally any other public good, just remember, the math is absolute, the biological shield is real, but ultimately it's human behavior and communication that keeps the tower standing tall. Keep learning, keep explaining, and we'll catch you in the next one.